So we're ready for our next plenary session, which is strengthening EU leadership in global health security. So Europe's role in global health security is evolving rapidly. We're confronted with overlapping threats from emerging pathogens, climate-driven instability, cyber attacks, conflict, and disruptions to vital supply chains. These risks are interconnected, and our responses must be interconnected as well. A lot of what we heard from the opening session, of course. If the EU wants to strengthen its strategic autonomy and reinforce its defense and security agenda, then health has to be integrated as a core component. Health systems are not separate from security. They enable national stability, international cooperation, and social resilience. Our panel today reflects the diversity of expertise needed to navigate this complex challenge. Cybersecurity, civil-military coordination, climate and environmental health, and health system governance at the EU and global levels. Today, in this session, we're going to explore how Europe can act decisively, collaboratively, and strategically to become a true leader in global health security. So please join me in welcoming our panelists to the stage for this session. We have Ms. Karolina Kozlowska, Support Action Service Coordinator at the European Union Agency for Cybersecurity. Colonel Henk van der Wal. He's the head of the Civil Military Center for Expertise for Trauma Care in the Ministry of Defense of the Netherlands. And of course, we have Mr. Claudio Lanza, Senior Policy Officer on Health and Climate at the Health and Environment Alliance, or conveniently HEAL, and Ewout van Ginneken, Director, European Observatory on Health Systems and Policies. So thank you all for being with us today. And I think we will probably start with the best dressed man in the room. And Henk, I'm going to come to you for the start because I think a lot of us in the room are not really familiar with the way that healthcare might work in the military applications. And I know that's really your specialty. So maybe you want to share with us a little bit about civil-military cooperation on healthcare, what lessons we might be able to take from the work that you do on health within a military setting.
Thank you, and thank you for the invitation. So, and also for the compliment, of course, always nice to hear. So, what I will explain a little bit, and when we did the preparation, was one of the questions was like, okay, do we need a formal civil-military mechanism within the EU? And actually, so my answer, short answer, would be yes, and then we are ready. But to elaborate a little bit more on that is that. We need mechanisms, but on the other hand, there are already a lot of mechanisms. So we have to be careful not to duplicate, and we have to emphasize on other things, and I will address them later. So start with a little bit from where we are, and what we have is like looking at NATO, because I think that's the best example to see what kind of mechanisms are there. And so NATO is a military organization, or actually a political, diplomatic, military organization, all kind of levels from the heads of state, and we have a military committee with all the commanders of the armed forces of all the NATO member states. But also there's a committee, we call it COMETS, and that's the Committee of Chiefs of Medical Services. So it's like, you know, like what I always sometimes said. We said formally Surgeon Generals. You can also say like, you know, the top doctors in every military service. And actually they come together and they have a structure where what enables them to provide advice primarily to the military committee. So the highest military level, and make sure that it also will go to the political level. So it's really military engaged, and they talk about everything. So also looking at military health systems, but they're also looking like, you know, like clinical developments, how we can make the care better for our service members. And actually, it's all based on like what I always like to mention in a way is that we try to save and keep our soldiers safe. But on the other hand, it's also like, you know, building on to keep the organization ready for their mission. But it's like, you know, normally it's when you get wounded, you get your treatment in a hospital, rehabilitation if necessary, and then you can keep going on with your work. But especially with the geopolitical developments on this moment, and when there would be like a war, and there's a war also already going, like what we see every day in Ukraine. So if you get wounded in a war, and then actually from a military standpoint, it's all about return to duty. So it's, and actually I'm doing research on where I'm looking like, okay, I think quality of life for every person is important. So that's more like, for a person perspective. But on the other hand, for the military, it's return to duty. How soon, how quick can we treat somebody? And actually we can send them back to the war if necessary. So that's from the military perspective. There's already a little bit a civilian side, also very interesting. This is what we call the Joint Health Group. It's filled with civilian experts from, again, all the NATO member states. And the interesting thing is they looked more in former times, until a few years ago, they were mostly looking at like crisis. Pandemics, that kind of stuff. Like the military side was looking at more the war fighting stuff, to call it in that way. So, but now they're coming closer together. They have meetings together, and actually, they in the preparations for what's happening in the world, that's where they're working on. So then, stepping over also to the EU, it's like, the EU military staff. There is a European Union military staff, and they have actually a military cell there. And that's also interesting, like, when you see it in NATO, and because it's established already, like, what is 75 years, it's very robust, and we're looking at the EU military side, it's like, it's 2 doctors, that's it. So it's really like, and a few weeks ago I spoke with one of them, he's a Dutch doctor, and he said, okay, they are busy with everything, and I think, okay, but you're only with the 2 of you. And like in the NATO side, there's a lot of, and even in the member states, we are with much bigger number for everything to do. So, but actually there are things going on in the EU also. There's like, and I wrote it down, I have to, because it's a technical working group of civil military cooperation on health security preparedness. So it's like, it's a lot of words. But that actually is a good example where the EU member states are coming together and actually are going to, in a way, kind of where when I was talking about the COMETS organization, that committee, kind of a little bit the same similar things where they're dealing with, also making preparations on the EU side, into the preparedness and also the resilience, because that's really important aspects of that. So that's a good development to work on from that side. And actually, from member states, both NATO, EU, what you often see in like the Netherlands, and I can only speak from the Netherlands, of course, is that we bring in the same officers going to both meetings. So that makes it also more effective that we can talk the same language. But and that's something like, which you can promote to do that for all member states, both on the NATO side and on the EU side. I will leave it by this.
Great, thank you. That's a great introduction to the work that you're doing, and I think something new for a lot of us, so it's nice to hear a fresh perspective. And similar to that point, Carolina, I'll come to you because I think you also have a perspective we don't hear often enough, and that's of cybersecurity. When we think of defense, a lot of us think of physical attacks and violence, and Henk, you mentioned wounding and injuries, but I think cybersecurity is something that a lot of us maybe don't think about at all or think about in the background. So maybe you'd like to share some of the work that you're doing on cybersecurity and health, and maybe make the case why that's also very important for us to focus on.
Thank you very much for the question. Thank you for having me. Maybe first I'll just again repeat from where I come. So I'm working in the EU Cybersecurity Agency, ENISA, which is headquartered in Athens, Greece, but I'm based in the local office here in Brussels. And indeed, I really appreciate the question, because cyber is indeed not the first thing that comes to your mind when you think about the security. But since COVID-19 pandemic, I think our way of life shifted. It moved very much towards the online life. And this is also the case. Sorry, this is also the case for the health sector. So you see that the EU citizens are resorting more to online services, and this expands the attack surface and makes the health sector more vulnerable to cyber attacks, the ransomware attacks, denial of service attacks, and so on. And for years, ENISA, the agency in which I work, was has been supporting the health sector through many different initiatives. So there were publications for good practices for the health sector, awareness-raising campaigns for the sector. ENISA provided also support to the member states of the European Union to boost cybersecurity capabilities of their health sector. And I can say that all these efforts were not in vain. So luckily for the last years, we see that there's more development in the cybersecurity health sector. For instance, the Network and Information Systems Cooperation Group, which consists of national competent authorities for cybersecurity, established a dedicated work stream on health, particularly where they share information, best practices, their approach towards cybersecurity legislation for the health sector. ENISA engages also with the industry through the Information and Analysis Center for health sector. There's the annual cybersecurity conference. So there are definitely steps in the good direction, but we still see that more has to be done. Every year, ENISA publishes its threat landscape report, and there was a dedicated one for the health sector published back in 2023, and it shows that health sector is still heavily targeted by malicious threat actors. Over the half of the incidents are the ransomware incidents. And for the last 4 years, well, since 2020, health sector was the most targeted of all the critical sectors across the EU. So it says a lot. Now it's changed only because of the geopolitical situation that you mentioned, and now the public administration is mostly targeted just because most of the attacks are caused by hacktivists. But in any case, what I can say is that I can see that the situation is changing, but unfortunately more has to be done. And I'm really happy that I can be here and that you are taking the topic of cybersecurity seriously. I'm happy to be able to raise awareness maybe also a little bit further, but I'm not taking too much time now. Thank you.
No, indeed. I'm actually going to stay with you because I think we need to drive this point home just a little bit further. For me, it's surprising, and I think maybe for most of us, that the health sector is the most targeted sector by cyber attacks. And you mentioned things like ransomware and hacking attacks. And I think in my mind, the first thing would be maybe they're just trying to get some money from the government. But I know you told me a story that maybe I can ask you to share, that this actually has much more serious human consequences sometimes.
Yes. And the story that I'm going to tell you, it sounds like a story from a dark dystopian movie, but it's actually a true story that happened back in 2020, September 2020, when so we were like all the hospitals in the EU were fighting COVID-19 pandemics, and there was actually the first case, world's first case, reported when there was possibly a deadly victim of a cyber attack. And why? What happened? So in September 2020, there was a big ransomware attack, precisely. So the whole systems of Düsseldorf University hospitals were paralyzed. And so one of the patients had to be urgently drove to another hospital, which wasn't that far away. It was 30 kilometers, but sadly, the female patient died on the way. So as a result, the German police started investigation, and the hackers were, there was an investigation where cyber experts were also involved, whether it was a direct cause of the death, and the hackers could be responsible for such incident. To be honest, I haven't closely monitored the investigation. I don't know if it's finalized yet or not, but this is very saying. So we already see how dangerous that could be. So ransomware is just one of the attack. And to give you the information, the ransomware can be triggered by very simple phishing attack. You know, the kind of Algerian prince is sending you an email that you should wire them some money. This kind of attack. So I'm working at ENISA at a great project that, well, maybe I will just explain a little bit more what it is. So it's called the Support Action, and it's a one-of-a-kind program where ENISA was entrusted with significant funds. It was first 15 million, then it was renewed, and we get, again, 15 million to provide preparedness and incident response services to the member states and their critical infrastructure. So it was really hands-on. We could see the tangible results of what ENISA was doing. We provided many of those overall about 300 cybersecurity services by now. And the health sector is the second sector for which services were ordered. So I have a chance to work with the European member states, and many of them, because it's up to them to decide what kind of services for which sector they choose, many of them put really big emphasis and focus on the health sector. So being a coordinator of the action, I'm really involved in the service delivery. So I am, so to say, there in the room. When, of course, I'm not going to disclose any details about particular hospitals, but we see same trends in many of them. So the hospitals are understaffed. They are underfinanced. And of course, I do understand that there are different priorities, not only in the European Union, but elsewhere, everywhere in the world, when probably hospitals would rather invest in medical devices, emergency supplies, and so on. And cybersecurity is somewhere there. So they would, for instance, task IT staff to be responsible for cybersecurity, and we should emphasize that these are very different profiles. I mean, it sounds like IT expert does everything, but it's really not the case. So cyber hygiene is lacking. Like, you know, people click on malicious link and then the ransomware spreads. The systems of the hospitals are paralyzed. Data breaches, I mean, it sounds, you receive this email saying that, well, your data leaked. It was like, okay, well, it happens. But it's much more dangerous if your data, if your health data leaks. Then imagine if it's in unauthorized hands. I know there will be a session about health data, so I'm not going in depth here. But for me, like, you know, when I'm sitting in these meetings and I'm hearing about the results of a penetration test and the physical intrusion test that was provided for a hospital, and I hear that in the hospital full of people in the day, the testers, you know, we write these get out of jail letters. So there are our testers, our people. They can just come to the hospital, say to the people sitting in the room, sorry, I'm from the IT service, I just need to plug in my device. They actually come in, they plug a device, no one bothers because they take it for granted these are IT workers. This is as easy to get into your systems. It's scary. And I'm very happy to see, I'm sorry for taking so much time, but just one sentence. I'm really happy to see that this is being addressed. So like really member states are looking seriously at this and they put more emphasis on funding on cybersecurity. They see the danger and thank Lord. Thank you. Sorry.
Thank you for sharing. No, and I think the idea of cyber hygiene is really interesting because we all have the idea of hygiene within health. I'm sure if you walk through a hospital, you'll see 100 signs that say, wash your hands after every interaction, but how many of them will ever say, change your passwords or secure your devices so that data is protected? And I think that's an important point to make, especially with the idea that it was more of an abstract concept, so I know, thank you for sharing that story because it puts things in a really human perspective. And on that note, Claudia, I'll come to you because I think you work obviously on the intersection of climate and health. And this is also something that intuitively is a bit hard for us to grasp without a bit of a human element. I mean, we all have an idea of what climate change is and the concepts or consequences that will come from it. But how do we really do a better job of linking climate action to health outcomes? How do we do a better job of linking environmentalism to protection of our health in Europe?
Thank you for the question. Thank you for having us here, Health Environment Alliance, short for HEAL. In this panel, very interesting panel, diverse. And first and foremost, I want to spend a minute on the concept of security because I think that's also what this panel is about. Nowadays, security is much more conceptualized as something that is about the state security. Cybersecurity is partly about that, but it's also individual security. And I think we had also interventions about the civil societal aspect of security. And many of the words that we use for cyber and defense, we use it for civil. And in the context of climate and health, these are relevant because these are preparedness and resilience. preparedness to extreme weather events, and resilience, long-term resilience. These are two very important words that are relevant for health as well, because security is a contested concept, but can be understood as in terms of how do you answer the question security for whom, for which values, at what costs. And so for us, security is about the people, and especially the most vulnerable. But it's not just about that, because the evidence is clear. We live in a world where there is a triple crisis of climate change, biodiversity loss, and pollution. And so we have evidence of the impact of climate change, biodiversity loss, and pollution on people's health every year, every month there is a new report. Despite all that has been done on environmental pollution, but also on the effects on climate, still there isn't much that has been done on adaptation, meaning resilience. We still live in homes that are not, they cannot cope with extreme heat. And there are some places, I'm from Naples, and I have to come to terms that I might be one of those workers that wants to change their location because it's too hot to work in the place where they are born, right? So just to give a sense that this speaks to us as a society, but also as individuals, and many times we are not necessarily aware that we are driven by health considerations when our environment, including our climate, changes. Now, there are many, so to give you a stark understanding of why this health in the context of climate can be understood as a security issue. Now, the summer of 2024, 62,000 people died prematurely due to extreme heat. And these are numbers that continue to be very high. Air pollution continues to lead to early premature deaths in hundreds of thousands every year. Environmental gap, adaptation gap, these are all measurable, quantifiable numbers that we can use to speak to decision makers and say, this is not about nagging for more money. I agree that that's not a helpful framing. It's about implementing what we already decided and making sure that they make a change, a difference for people's health. And so for us, climate and health is important because, and this is the last thing I'm going to say about it, if you go to, and it was mentioned in the previous panel, if you go where decisions are taken closest to the citizens, to mayors and cities, for instance, in the context of EU mission for net neutrality and EU mission for adaptation, mayors know that most times mitigation measures can be sold to citizens, and citizens can be part of the solution when you stress the health benefits of those measures. And so having health in and for all policies is not just for better health for citizens, people, but also the planet and the environment, but it's also for democracy.
Great, thank you for that. And I think that rounds out kind of the different themes that we can have here. So actually, Eva, I'll come to you maybe to bring it all together because for the time being, what we basically were talking about maybe a crisis in slow motion when you mentioned the idea of heat deaths increasing year over year and how we communicate that properly to get intake for buy-in from citizens. We have obviously the military and the cybersecurity perspective, but then obviously we have cases where there are a crisis beyond crisis, something most of us don't imagine, and that's a real wartime scenario. And I know you shared with me that you've had some experience seeing the role of the health system in such a scenario in Ukraine and how that actually holds the society together and helps to build resilience. So I wonder if you might share a little bit with us about your experience.
Yeah, I'm happy to, because I think that trip for me showed the importance indeed of a health system when a country is under attack, as Ukraine was. I was there in November last year. We had a conference there underground in the basement just to make it be available. It was about rehabilitation care, by the way. And we also did some visits to some sites that were hit and then again reconstructed, and people were providing services there. What you could really see also from talking to the people is that having that system in place and for the people to know it's there to take care of them is incredibly important for the morale of the country. So they invest a lot in immediately getting back services when an area is attacked. Because if you think of news media coverage, what do you see coming from those countries? If you turn a TV on, you see demolished houses, people walking in between. There's a lack of medicine, food, etc., but also healthcare, really. Vulnerable people, very vulnerable people that need to be taken care of. So that just shows you the importance of the health system under a wartime scenario. And then to bring it a little bit together with the health security element here, I think what we need to understand is that we often think we are prepared, and there is research, there are certain different measures that show that countries were, for example, on paper quite prepared for the pandemic, and then in practice it turned out not the case at all. And then the ones who were maybe not so prepared, according to all the research done before, were actually doing quite well. So I think that one professor I know, Steve Thomas from Trinity College Dublin, called it "bad governance eats preparedness for breakfast." And that's exactly what it is. So how do you then become better prepared for scenarios that really threaten our security? And extreme climate events is one, a cyber attack is another, and an invasion is another. But how do we know that our system will react under such a scenario? And for that, we have developed what we call resilience testing, so that you can really run a scenario and then with the right people in the room, see how they react, what are the plans, what happens in practice. And I think that is a way forward for us to explore more for these kinds of scenarios. We have been testing those with some other countries. It's actually work we've done for the European Commission, so kudos to them, together with our colleagues from OECD. So I think there's a lot to be gained there, and to understand how the system will react, because I think there will be surprises anyway. And for example, talking about Ukraine, we have very good connections there and we will keep supporting them. And one of the things we will do is that we will write up for the health system the measures they took during the invasion, in terms of their financing systems, their workforce, the delivery of health services, but also governance. So I think there's a lot of learning there as well, but I think resilience testing scenarios could be a way forward here.
Yeah, and I think that's a great point, because we need to move at some point from the theoretical to the practical, because the theoretical becomes real sometimes. And indeed, Henk, I think the role of the military more than anything else is to be prepared for anything that might come. So I would guess maybe on top of something like resilience training, what else can the military teach us about being prepared for everything? What kind of skills do we need to build in people in advance so that when something does happen, anything, that we will be more prepared, more able to handle it appropriately and not fall victim to bad governance, as we'll say?
First of all, I want to go back to the Ukraine, because actually for us, one of the lessons we already learned is that when you see, because the war in Ukraine is in Ukraine, so they actually, the war fighting is on the front line with the military capacity, but on the other hand, what you see is the civilian healthcare is already integrated. So and where we have, in our military, we have a real nice evacuation medical chain where we say, okay, from the point of injury you go to a role 1, what we say, that's like a primary healthcare center in the field. Then you go to a small field hospital. Then you can go to a bigger one, and then we fly you back home. But actually, but that's actually talking about in the scenarios from the last 2 decades when we were in Afghanistan and Iraq and Mali. That was the way it was organized. You get wounded in Afghanistan, you get your first surgery in Afghanistan, then we'll fly you back to home. But now it's really different in Ukraine. And you see, okay, you get wounded, then it starts already, and I really have to mention that. It's like normally in NATO we have the old golden hour for us that now is like 10-1-2, 10 minutes, then you need the first help. And then actually the ideal situation, within an hour, you have to be on the OR. But now what you see is like when you get wounded in Ukraine and in the trenches, and then maybe some of the wounded, the battle casualties, they have to wait 12 hours or maybe even 24 hours before they can be transported. And they only can be transported in darkness because of the drones, all those things. And that's really something we have to learn, that it is different. And then it makes it really harder. So we have to think about evacuation. What's happening? So do we look at Ukraine as the scenario we have to deal with? But for us in the Netherlands, it's like we are not in the front line. And we actually, so we are in the back, in the rearward situation. So we have to think, looking at healthcare, military healthcare in a different way, and we are even more, in a different way, look closer to civilian healthcare. And that's the civil-military interaction we have to organize in a good way. And actually to be a little bit more practical, because I think that's what we needed in this situation. For example, we have now sent out a liaison officer from our military medical service to the Ministry of Health. And actually, so that's of course that you can talk about it from a capacity building perspective. So they have a stronger directorate at the Ministry of Health. But it's also about what I always say, it's like bridging the cultures. Talking the same language. That's more and more important, because that's the only way how we can solve or deal with a crisis like this, or what's happening, what all the developments. One of the other things we also have learned is that there are some initiatives that we take, for example, colleagues from the Ministry of Health, but also like with civilian hospitals we are working, take them to military exercises, show them how we have to deal with it, to learn how to, because we as in the military, we are really about organizing and about planning, and our whole mindset is about education and training. We always train for the fight. So that's the whole idea. So that's also a solution. Some other things we in the Netherlands, and that's more from started in the COVID period, is we have it's translated like it has a Dutch name. It's the National Healthcare Reserve. That's about 5,000 volunteers, all care professionals who volunteer to be, so we can use them for where needed. And those are also things where, for the EU, for example, can think about like building a surge capacity. And if you do that from the member states, make it bigger, then you can really work on a big capacity for the whole European Union. Because when something has happened, it's not only for one country, it's for the whole EU. So that's also an example. So.
Right, and I'll stick on the theme of moving from theoretical to practical with your neighbor, Claudio, because you mentioned the example of in Napoli, for example, we have an entire workforce that maybe cannot do its job anymore because of extreme heat. And obviously that, I think, makes a bit of an economic argument about why climate change is a threat to security. But how do we speak the language of these local regions? And maybe you have a few other examples of where we need to translate the idea of climate change, not just as this abstract idea, but as a real security threat to our way of life, to our health. And maybe I'm sorry to put you on the spot, but maybe you have some other examples from the work that you've been doing and trying to really express the nature of this problem.
There's one example that I have brought to the attention of decision makers that I think is quite telling. So now the European climate law is under revision. There is the 2040 climate target is under negotiation. And the reason why that's the case is because the European climate law is the first law that legally binds member states to take action on climate mitigation with intermediary targets. The same law includes wording on climate adaptation. We do have a legally binding target for having a net neutrality by 2050, but we have a vision to have a resilient Europe by 2050. I would argue that we cannot afford to have a vision. We need to have legally binding targets, and perhaps before then 2050, because we were talking about hypothetical and scenarios. Climate change is having an impact on people's life now. Climate change is, the climate crisis is a health crisis. And there are, in the context where innovation is being spearheaded, like in cities, especially in the EU mission Cities for Adaptation, for instance, there they know that they cannot afford to do climate mitigation and climate adaptation in silos. They need to do them in an integrated fashion, not even in a complementary fashion. Why that's the case? Because you cannot afford to have different departments to work on different projects, to have different funding streams, and so forth. Plus mitigating, so reducing pollution and increasing resilience, they really go hand in hand, and at the same time, they deliver tangible health co-benefits. Now, is this something that, so these are the examples that I bring to decision makers, and I also want to echo the importance of funding that was mentioned earlier, because this is a challenge and an opportunity to have the next multi-annual financial framework where such a holistic approach is adopted. I'm not sure that's the case, but that's why we are here.
Great. I think that kind of open question allows me to throw it to the audience quite naturally, because I think we have a lot of perspectives on the tape on stage here who you might not get to ask questions of very often. So I wonder if anyone has a question from the audience. Sure. So again, just introduce yourself and then say your piece.
Hello, good morning. I'm Mariana from Portugal, and I work as a healthcare manager in a private hospital in Portugal. And my question is, due to a cyber security attack, it can be really dangerous for hospital because it can stop surgeries, for example, and we lose data from patients. So it's really, really bad. And how can we survive this? Or how can we prevent? Or if it happens, how can we minimize the consequences? And the other question is, how, as hospitals, can we deliver high-value care to patients by integrating a climate questions and issues in that delivering of care? Thank you.
I guess it would be me for the first one. Thank you so much for the question. It's a great question, actually, and I'm very happy that I can answer from the European perspective. Now, just recently, in February this year, the new law, the European law, EU Cyber Solidarity Act, came into force, and it sets a very good ground for a great initiative that I'm happy to represent. Is the EU Cybersecurity Reserve. And the program is about helping member states and the critical infrastructure, such as hospitals, to deal with real-time incident response. So in case there is an incident in a hospital and the hospital takes the first steps, it sees it's a significant incident they cannot manage on their own, the member state's point of contact can contact ENISA, and ENISA, together with trusted services providers, reacts to provide incident response. And the time limits are very short, so it's about 4 to 6 hours for the first reaction, 24 hours if we need to send troops from abroad to the ground. So this is one of the things which we can provide really tangible results and help on the spot in case of a cyber incident. And for the member states, of course, there are also national remedies. There are national computer emergency response teams that support such institutions. But from the ENISA, I can say that Cybersecurity Reserve could be a good option here.
Do you remember the second part of the question, or maybe Eva?
I do, and I would like to answer, but maybe you would want to no? So that was the question about greening and what would be the arguments. I think I alluded to that already in the first panel. There is a lot of evidence that greening measures in hospitals, like reducing waste or unnecessary treatment, are fully aligned with other health systems goals. That will improve your efficiency, will save you cost. And if we all do that together, and I think Spain is actually a good example of a country who's trying to put that on the agenda, I think we have very strong arguments to have a strong greening agenda because goals are aligned. It should not again be seen as some sort of an extra expenditure, but really as an opportunity. And how to then do it is, of course, perhaps more complex than I make it sound here. We need to get everybody on board. And all the people in your hospital are very busy, I'm sure. And if you tell them, oh, let's start this new initiative, but it will have to come from them as well. They need to be, you probably need some strong leaders in your organizations to get it started. And better, the more we do with the more hospitals or the health sector as a whole, you really can have a very positive impact on climate policy. And therefore, worth going for it. I think with the right arguments, I don't see why we shouldn't.
Just to add that I, at least from the conversations I had and I've witnessed, the power of best practices is very important, and there are others who already started change. And as it was mentioned, it is difficult, but perhaps knowing that it is possible and it can be successful, that can also help with inspiring leadership, because I think you cannot really do without those implementing it on the ground. But on paper, it's clear that the evidence and other practices are clear that this should be the way forward also for the healthcare sector.
Thank you. My name is Stef Dienstra. I'm lecturing at the NATO School in Oberammergau and lecturing at several other institutes. And one of the aspects is CBRN, chemical, biological, radiological, nuclear threats. And that is not a threat for the military only, but also for the whole population. And especially on the new emerging infectious diseases, which are coming up due to climate change partly, like chikungunya. You can also have man-made new emerging infectious diseases. And I would like to ask to the Colonel whether you mentioned already the medical reserve, mostly retired practitioners. But do you think that also the armed forces, like in other countries, they take the role, should or must have a role in the medical care when such an outbreak needs upscaling in care?
Again, short answer, yes. But yeah, but I think we have. No, I agree what you're saying. So we have to be prepared. We have to, and it is not only a military situation or military approach only. What you see now is that we are talking about those things, but it's still like when you see it, we are looking more in a kinetic way now, looking at the war, what is going on there. But also one of the things which close there is also the micro. Yeah, AMR resistance. Like, you know, so we already have, like, for example, what I was talking about with the evacuation of wounded from the Ukraine, or if there would be a war, like evacuation them from somewhere in the east back to the United States, for example, is like with the how to deal with the antibiotics. So those are the things we are already thinking about it. I know in the my civilian colleagues in civilian hospitals, they're thinking about it, but also we have to bring that together. There has to be a mechanism again where how to deal with it in an integrated way. So I think it's also valuable to look like how can you organize that, and I think there's attention for it. But give the real answer, like how it's organized, I think there's still work to do for everybody.
Thank you. My name is Hein Imbrechts, working here in Brussels, Cienzano. I'm very glad to see this panel, and also to emphasize on the climate change. And as a veterinarian, I think that there is another risk here where animals, of course, the vectors, they get used to normally they need warmer weather, hot weather. Now they're reaching us with their pathogens as well, not only pathogens for animals, but also for humans. It was already mentioned, and also zoonosis, West Nile virus or tick-borne diseases. So I think this is really important to emphasize it and broaden the scope towards animal health, I would say.
And indeed, let me stress that climate impacts are not an hypothetical. Vector-borne diseases are already spreading in the southern part of Europe. So I think it has to be clear that besides hypotheticals, it's important to be prepared for those and to be resilient. But there are certain impacts, like climate impacts, that are already here. And according to the European climate risk assessments published last year, some of these effects will be catastrophic if proper action is not taken, especially when it comes to high heat temperatures in the southern Europe. And there are, of course, military bases there, but it's just to state the obvious. I think when it comes to these particular approaches, again, the One Health approach considered biodiversity loss is also something that nowadays is outside of the contemporary policy priorities. Today is all about competitiveness, security, and also defense. But I don't know if we can securitize biodiversity. I don't know how much we can securitize, wish to control something like the climate, something like the environment. Their securitization and security policies should really be, and here I echo what has been said in the first panel, prevention, and building resilience.
Yeah, just to thank you for making that point, which is of course a very important one. That's the One Health approach that of course should be on our minds at all times. And animal, but also nature need to be protected and at all costs as well, because these are important elements as well that we should not forget.
Great, and I think we have time for at least one more question. So did I see someone over here? I did, perfect. So I'll bring you the mic.
Thank you. Niamh Lennox Chugani from IFIC, the International Foundation for Integrated Care, and thank you to the panel for a really eye-opening discussion. Certainly there are many things here that I hadn't even thought about before. But I wanted to bring it back to one of the themes that was coming out of the first plenary, which is around civil society engagement and engaging with communities, because much of what you're talking about, even in the military sense, requires leveraging all of the strengths and assets that we have already in our communities and our civil society. And we saw that, we didn't just see it in war, we saw it in COVID-19. We saw how our civil society and our communities stepped up and actually stepped into the place of many of our health and care systems across Europe. So I'd be interested in the panel's thoughts about how do we balance our desire for sort of central control in cases where we feel our security, including health security, is threatened, against actually localization, which is actually where most of the action happens in stepping up community resilience.
This was actually a point I was thinking about, looking also at the first panel, because when I talk on the military, it's always at a national level, and it's also like cross-border level, because it's always international engagement and everything. But what you see now, and that's why it's important, we also have to bring it like to the local and the regional level. And on the moment, like, and again, from a Dutch perspective, is that we have a task group who's working on a narrative, preparing like how can we work on the preparedness and the resilience at a local regional level. So what they are going to do is they're going with a task force. We have like our countries covered in, I think, 10 security regions. So that's a combination with like, with the hospitals, police and everything, all those authorities. And actually they are going to that level to talk with them and then tell them the right narrative, how to prepare and how to be resilient. And so the only thing which stays open, actually my hope would be from that local, regional level, it will also go like as an oil stain on the society, but also to our civilians. And that's the only thing I would say, okay, how can we even better disperse the message to everybody in our countries? Because actually, for example, I can sit here and talk with you about it, but it's not my job actually to stand on television and tell it to everybody in the Netherlands. But it should be done in the right way, not to make everybody too much scared, because that you can also be to make it the message too big, but hopefully in the right level, but on the right position also. Hope that helps the answer.
I always wanted to say these words. I have two words for you: rebound effects. So research shows that when climate action, for instance, doesn't take into account people, then behavioral aspects become so important that climate action lose its purpose and its effects. So rebound effect is measures, for instance, how much people might continue to use, for instance, systems like heating and cooling in their housing after they're done the renovation. And so consumption increases instead of decreasing while we are trying to make housing more sustainable. And so rebound effects is a clear example, I think, also for you and for the question that you are asking, that without taking people on board, the intended solutions do not really work. And so, yeah, I totally agree with you. That has to be high on the agenda.
Great, nice and concise. And I think for that reason, we have time for one more question. And I'll leave you all in the hot seats just for another couple of minutes. Hope that's okay.
Hello, I have a question for the Colonel. My name is Jacob Levy. I'm with the European Health Management Association. Well, maybe I will direct the conversation a bit to a different point. If you browse around, you see countries with advanced military capabilities, such as the US or Israel, that they have units that perform kind of prevention activities as regards to public health risks, such as predictive intelligence on biological threats or advanced laboratory pathogen identification. So do you have any case study of a member state country that performs in that way? And if not, which competencies, which structures are we missing to go that way? Thank you.
Actually, it's like the big countries, and like the US, for example, actually covers a lot of what you were saying. I think also I think most member states, they have their own initiatives working all the things you were saying. For example, like, where we are on the military medical side, really looking at how can we support the operational, the armed forces, the fighting force. On the other hand, so that's more on the, like, on really supporting the fighting force. On the other hand, we all on the preventive side, we're also looking at what we called sustainable health. Health readiness or something. I just have to translate it. But it's like, on looking at healthy food, sleep, exercise, mental health. So we're working on that one too also. And that's, you can say, okay, maybe that's prevention, so that's less important. We have to support the fighting force. That's it. That's the main target we have to or the main aim we have to support. But on the other hand, we have to prepare also on the prevention side. So I think there's quite some initiatives going in. Even the work what I'm doing is like, for example, we are also on the prediction side and using AI and everything. Is, for example, we like to use as an example measuring the depth of a burn wound after getting wounded, getting burned in the field, because maybe we can improve the starting treatment in another way than we are doing right now. Especially looking at what I explained with the Ukraine. If you can, like, normally, everybody knows you have a burn wound, you have to cool it with water for quite some time. But when you are in a trench, there's only one bottle of water you use for your personal use, and that's all the water there is. So maybe with the prediction, with research into prediction measures, we can provide a different treatment or starting treatment with a better outcome for the wounded soldier. And I think, and when I talk about those examples, it's almost everywhere. And it's actually, but then again, looking at mechanisms for cooperation, the downside from that is a lot of countries are doing the same things. So I hope we are also looking, okay, where we can join each other to do it like as a joint mutual effort.
Great, thanks, Henk. And I'll leave the microphone with you, because what we're going to do is similar to the opening session. We'll come around and just have a final thought from all of you. And what I think I'd like to ask you all is to answer the question, because we started at the outset saying there are clear links between health and security, and we're going to show you and we're going to talk about them. So if I'm someone who comes to you and asks the question, I don't really see that health and security are linked together. From your perspective, what answer would you give them? And maybe we can all take that back with us and be able to answer that question ourselves. So I'll start with you, and then we can move forward.
Yeah, the first thing I think is like health security is security. So there's actually no difference. So it's fully part of the security environment, and so you have to deal with it. And then a second thing is like from a military perspective, I'm always like, you know, we're talking here about the word managerial, managers, but actually it's also about leadership. So strong, trusted leadership is where you have to invest on. And actually mutual trust is for me always one of the most important elements to solve problems.
Great. And Claudio?
Someone in the first panel said repetition, repetition, repetition. So we are in a triple crisis of climate change, biodiversity loss, and pollution. So security has to be for citizens, especially the most vulnerable, but also for the planet and for the environment, because we know they're interlinked.
Great point. Carolina?
Thanks. So in security, when we're testing our resilience, first we need to identify the greatest assets. What is the greatest asset we all have? Health. So of course we need to focus on the health security, and whether it's climate security, biological security, cyber security, it's still security. So of course all the topics are very linked. And just to mention that what I liked a lot is in the panel, I think every one of us repeated preparedness, resilience, capacity building, and this is on what we really need to focus.
Thank you. And Ewout?
Yes, I think that we have preparedness plans that need to be improved. Resilience testing is a way also to bring in civil society, for example, and have an inventory. To that person, I would say, come join me in one of those hypothetical scenarios and see what what the links are between a given crisis and health. And there are many, and that person will be immediately converted. Thanks.
Personal experience is powerful indeed. And as the experience we've all had today, I would like to thank you all for being here. Thank you for your diverse perspectives. Hopefully we all have something new to take away. And a warm round of applause for our speakers.